Hi everyone. My name is Laura Voith, and I'm an assistant professor at the Jack Joseph and Morton Mandel School of Applied Social Sciences at Case Western Reserve University in Cleveland, Ohio. Three colleagues and I, Katie Russell, Hyunjune Lee, and Dr. RaeAnn Anderson, wrote a paper now published in the journal Family Process titled Adverse Childhood Experiences, Trauma Symptoms, Mindfulness, and Intimate Partner Violence: Therapeutic Implications for Marginalized Men. There exists a well-established literature on how adverse childhood experiences, or ACEs, and trauma symptoms are associated with intimate partner violence perpetration and to some extent victimization among men. However, we identified several gaps that hamper progress in the field. First, post-traumatic stress disorder, or PTSD, dominates the field's scope of trauma under study, despite clinicians reporting trauma presenting differently for individuals who've experienced prolonged forms of trauma, such as child abuse. Second, most studies only look at physical abuse and do not include other types of IPV or the severity of IPV. Third, protective factors are rarely examined. And finally, fourth, most research has not focused on men of color, despite disproportionate rates of IPV among Black, Hispanic, and Native American men in the United States. To address these gaps, we examined whether ACEs, PTSD, severe complex trauma symptomology, and mindfulness are significantly associated with the frequency and severity of self-reported IPV perpetration and victimization among a sample of 67 predominantly low-income men of color in a batterer intervention program. There are several interesting takeaways from this study. First, more than half of the sample reported exposure to 4 or more ACEs, and nearly a third of the sample met the clinical cutoff for a probable PTSD diagnosis. Second, higher ACE scores predicted increased rates for nearly all types of IPV perpetration and victimization. Third, PTSD symptoms and complex trauma symptoms severity together explained between 13 to 40% of our IPV outcomes, and each were uniquely associated with certain types of IPV perpetration and victimization frequency and severity. Lastly, mindfulness was associated with decreased psychological IPV perpetration and victimization frequency and severity. Our study provides evidence that the high degree of childhood adversity and trauma symptoms experienced by men in the past month in our study may have increased their risk for both IPV perpetration and victimization. These findings suggest a need for more trauma-informed stepped care treatment resources to facilitate violence prevention more effectively. When resources are limited or stepped care is unavailable, we recommend providing trauma-focused treatment. We also recommend that batterer intervention programs and related programs screen for ACEs, including culturally relevant adversities such as systemic racism. This article can be used as a resource for teaching about the long-lasting impacts of trauma experienced in the early stages of life, particularly in the context of intergenerational transmission of violence. It would be great to have students consider how to incorporate the historical and cultural experiences of racial and ethnic minorities into the violence prevention field, particularly given that the clinical needs of low-income men of color in batterer intervention programs are less likely to be met, which may interfere with the efficacy of violence intervention efforts. We have made several other suggestions as to how this article can advance both the practice and research around the prevention of intimate partner violence. But we'd be happy to learn and listen to your ideas and thoughts about the topic. For further discussion or any questions related to the study, please contact me, Laura Voith, at laura.voith@case.edu. Thanks so much for watching.